Hey, good afternoon. It's Dr. Soloway. I'm calling from my buddy Tommy Serra's place. Tommy cuts my hair, so if you like my hair, come here and get your hair done. Nobody's better. He's the best. Joy's also the best. Joy's his #1 assistant. So anyway, I'm sitting here. He's doing somebody's color, wasting my time. But I'm going to talk to you about back pain. It's been a big topic. A lot of you have asked me to discuss back pain. And there's a couple of types of back pain. We could break it up into neck pain, mid-back pain, and lower back pain. We could also break it up into inflammatory back pain versus mechanical or non-inflammatory back pain. Or you can have traumatic back pain. So we'll kind of go through the list. You can have neck pain, mid-back, and lower back pain. And again, you can have inflammation, you can have trauma, or you can have something ergodynamically wrong, which is really another word for saying mechanical back pain. Alright, I'm going to show you something common. Here's my finger. If you look at my finger, it's normal, but if you bend my finger, now it becomes still normal, and if you x-ray it, it's still normal. However, you've changed the mechanics. If I keep my finger bent like this long enough, it's going to hurt. But there's nothing wrong with my finger except I'm holding it in a weird position. So therefore, that would be mechanical finger pain. If you're morbidly obese and your stomach sticks out too far, your back gets pulled forward, therefore you're going to get mechanical back pain. If you're sitting in the same position too long, you're going to get mechanical back pain. If you stand up too long, if you do anything too long, or your body's not comfortable with it, you will develop mechanical pain. So the first thing is to get rid of the offending insult. You could wear a back support, a corset, a lumbar belt. You can do core strengthening. You can do planks and bird dogs are two of my favorite exercises to strengthen the core, which helps prevent mechanical back pain. Generally that pain is, I would say, mild to moderate. It doesn't get severe. It certainly would not require pain relievers usually short-lived, something a massage could get rid of quickly. Alright, so that was mechanical back pain. Traumatic back pain, or I guess what I'm leading at is fractures. So if you have a fracture in your back, it can come from trauma or no trauma. If you've got a fracture in your back with no trauma, and you're elderly, the most likely cause of that pain is going to be osteoporosis. Sorry, I had to end a phone call. The most likely cause of that pain would be osteoporosis. However, if a fracture in the back occurs for absolutely no reason in a non-old person, that would be typically from a cancer that's spread to a bone. That's called a pathologic fracture. This is very severe, may be treated with radiation, pain relievers, narcotics, special braces. The vertebral fracture from osteoporosis can be fixed with injecting cement or a balloon, and then medications to help build the bone. Okay, so now that's your fracture. Inflammatory back pain, as we've talked about, inflammatory pain is when you have stiffness, warmth, tenderness, all the things that make up inflammation, morning stiffness. So most people, they go out, they mow the lawn, they have pain, so on and so forth. Those people typically wake up in the morning, they feel okay, or they have stiffness for 5 minutes. If you're under 40 and you wake up in the morning and you've got pain in your back or stiffness in your back and you can't get moving for 45 minutes or an hour, you have inflammatory back pain. So under the category of inflammatory back pain, our #1 condition is called ankylosing spondylitis, and the things that mimic ankylosing spondylitis of the spine can include, but are not limited to, other HLA-B27 related diseases such as psoriatic arthritis, Crohn's disease arthritis, ulcerative colitis arthritis, sarcoidosis arthritis. That would be a nice list for people to know. Those are treated with biologic drugs, such as Remicade. Patients do very, very well on these treatments. Prior to Remicade, People were addicted to morphine and had no relief. And of course, for all these types of back pain, it's always recommended a back support, 1 for protection, 2 for cushioning. It's sometimes recommended to sleep on your side. It's sometimes recommended to have a pillow behind your back. All right. So I just discussed with you pain in the back from inflammation, which we would have as a real disease, systemic disease, and we would treat with biologic therapy. We have pain from a fracture, which could be trauma or no trauma. We can have pain from change in position. And then the other pain, which I didn't mention, but now's a good time to mention, if you have back pain at night, you lie down, you go to bed, and your back is just killing you at night for no reason whatsoever. This is often a clue that you might have cancer or an infection. So if that back pain is waking you up out of your sleep, really don't wait. Don't try to be a superhero. Get to the office, get your back x-rayed, get a bone scan, get an MRI, get whatever you need. But don't let yourself be awakened by back pain that you don't explore. Okay, so that's your general overview of back pain. Now, if we add the neck, we can talk about the neck and the lower back as it pertains to sciatica. So the neck or the lower back can hurt, and it can hurt because, let's say, somebody has a bulging disc. The actual disc movement is not what hurts. It's when the disc actually, or the liquid in the disc, touches the nerve that's leaving the spine and often shoots burning, tingling, numbness, or other sort of vague symptoms down to the hands or feet. And this is called a radiculopathy. The layman's term for a radiculopathy would be sciatica. So sciatica is something that involves either the neck or the lower back. Now, people get arthritis in the back of or the posterior portion of their spine, whether it's the cervical or thoracic or lumbar, or in other words, the top, the middle, or the back. If you have that type of problem, your pain will be better when you lean forward or bend forward, such as if you're sitting on the toilet seat, the back pain gets better. If you're walking at the supermarket, you hold on the cart, your back feels better. But if you're standing or sitting for a prolonged period of time, you're increasing the pressure in the spine and on the facet joints, which are the name of the joints that are in the back that allow for motion that cause arthritic pain. While it's often a diagnosis of exclusion, it's really a diagnosis of taking a good history, examining the patient, and asking them a few questions. This can be treated with Tylenol, Motrin, Celebrex, can be treated with physical therapy, back support, various types of injections, namely lumbar facet injections or facet blocks, or median branch blocks, which are very similar. If you do happen to have the same problem in the thoracic spine, the pain is going to be felt radiating or moving around the ribs. That's a hallmark of that. Now, pain around the ribs, of course, that could be shingles or something else, but that would be on one side. Often a thoracic radiculopathy can happen on both sides. Anyway, of course, once again, this is not an encyclopedic lecture. And as you can see from my head, I'm about to get a haircut. And as you can see from my shirt, I just had my hair rinsed. Not that you're interested at all about this, but I hope you found the information on back pain interesting. It came up today in the office. Somebody wanted to know about it. And as always, I take what the patients say very seriously, and I attempt to expand upon what it is you patients, people, friends, colleagues, whoever. This is all about what you guys want to know. Thank you.